Right Care First Time is about consulting with the people of Greenwich about reshaping the process of delivery of urgent care in Greenwich. Urgent care is when people need medical care quickly, but it's not an emergency. Currently in Greenwich, this urgent care or unscheduled care, as we sometimes call it, is available from the patient's own GPs and from out of our organization called Grab-a-Doc, which is available evening and weekends when GP surgeries are closed. There are also 2 walk-in centers, one in Woolwich and one in Thamesmead. And there is the urgent care center that's co-located with the accident emergency department at the Queen Elizabeth Hospital in Woolwich. These services were developed and commissioned at different times. They are not coherent and they do not communicate with each other in terms of continuity of care of patients. We would like to see these different avenues of provision of urgent health care a little bit more coordinated to ensure that patients get all the care that they need from one source at one time. There are 2 main principles. First, we want to see GPs at the very heart of providing urgent care. GPs are very well trained and very competent in dealing quickly and efficiently and safely with the majority of conditions that patients present with for urgent care. That would leave the hospital A&E department free to deal with the more complex, life-threatening condition that require the facilities of hospital setup in terms of blood tests, x-rays, investigations, and higher level care. So we would like to see GPs being the first port of call whenever possible and whenever safe to do so. We would like to see all the residents in Greenwich registered with a GP to ensure that they can get continuity of care from the GP practice whenever possible. Currently, the main out-of-hour service provider, Grab-a-Doc, is located at Shooters Hill Road. It is proposed that this will be co-located at the Queen Elizabeth Hospital with the Urgent Care Center to be the main base for the provision of the so-called out-of-hours, evening and weekend care when GPs are not available. The walk-in centers are not linked to each other, are not linked to the urgent care center or to Grab-a-Doc, and we would like to evaluate the service provided, the wishes of the people of Greenwich, how we can best reshape this, or if necessary, recommission this, to provide the best possible care, as I said earlier, without duplication and without loss of continuity of care. People can get involved through the website, www.greenwichccg.nhs.uk. There is a response form there, and I would like to urge you all to use the form and let us have your thoughts. Your thoughts are very important to us. We need to make sure that this service is shaped around you as a member of the public, around your needs, and that we provide and develop and reshape a service that really, really meets your need, and as we say, right care, first time.